So generally speaking, the hip is a fun joint because it's a ball and socket joint, and it can do a lot of things. It has a lot of range of motion, and it can move in variable ways, and it should move that way. And oftentimes we do things that are sexy, like squatting, deadlifting, all these cool and fun things in the gym that appear to be very sexy, when in reality we haven't spent that much time maintaining our joint function and creating the best environment for our hip to do all that fun and sexy stuff. So here are a few unsexy things that you should start to do on your own, as long as it's pain-free and as long as you don't have any closing angle pain or dysfunctions. So this is not a prescription for everyone. So if you feel pain, this is probably not for you. We're going to start off with doing the pigeon stretch. So there's a few variations to this, and here's the beginning variation, or the first one I'm going to show you rather. This is our pigeon stretch. Most people can't get into this end range, which is fine. So what you're going to do is you're going to grab a yoga block or something that's nice and stable. You're going to drop your knee on that yoga block. This way, less range of motion in external rotation is required to achieve this position. So we're here, and I want your torso parallel to the ground or facing the ground the whole time. At the same time, I don't want to see this happening. Hips and torso pointing straight down towards the ground. A nice tall chest. This angle might vary a little bit at your knee. We're here, nice and tall, and what you're going to do is you're going to try and pull yourself nice and deep into the stretch so that you feel it on your lateral compartment or posterior compartment of the hip. So we're trying to create some hip space on the back side of the hip before we do any of the other fancy stuff. We're nice and tall. We're going to go nice deep breath in through your nose and out through your mouth, doing some diaphragmatic breathing while holding this stretch. You probably hold this for about 1 to 2 minutes, or you can prescribe it in breaths, whatever time you have, whatever you feel is right for you. So all we're trying to do here is create the space so then we can do the other stuff after it. After we've held for the prescribed amount of time, then we would get the other side and we'd move into our internal rotation stretch of the hip. So we go both legs and knees at 90 degrees. I want your front calf parallel with your back thigh, and I want your back calf parallel with your front thigh. All we're going to do here is bring your front-sided arm and grab your own glute or hip. Our back-sided arm is going to grab our shin. And all we're going to do here is we're going to engage and squeeze our backside glute as if you're trying to bring your hip forward. Really squeeze that glute, and you're going to try and drive your entire back leg through the floor. So the entire time we're maintaining tension and trying to create as much tension as we can the whole time. So pretend there's a scale on the floor and you're trying to get as heavy on the scale as you can the entire time. Paired with this, we're going to do our diaphragmatic breathing. Keeping the tension down the entire time. So you're going to hold for the prescribed amount of time or for the prescribed amount of breath. After that, another good idea would be to follow it up with some type of hip controlled articular rotation. So just bring your hip through its entire range of motion. So like I said, the hip is a ball and socket joint, so there's a lot of fancy stuff it can do. This is a good one. We're going to go hands underneath the shoulders, knees underneath the hips. You're going to push the floor away, engage your abs, think about bringing your ribs down to your pelvis. Keep the chin tucked, dig the back toes in, and you're going to keep this tension throughout your entire body the whole time while beginning to do your hip circle. I want nothing changing. I want your elbows to stay locked straight, moving nice and slow. Trying to challenge every single end range, whether it's hip flexion, hip abduction, hip extension. Elbows stay locked straight. You're going to move the same way, but now in reverse. So the idea is to create space in the hip capsule, to relearn or to address hip internal rotation, and then to move the hip through its entire range of motion.